Did you know cervical cancer is one of the most preventable cancers affecting women worldwide? Every year, thousands of women are diagnosed with cervical cancer. Here in the Philippines, it's a particularly pressing health concern, affecting nearly 8,000 women annually. The good news is, cervical cancer is largely preventable through early detection and vaccination. This episode will explore the impact of cervical cancer, specifically in the Philippines, and empower you with the knowledge you need to protect yourself. In this episode, we are joined by Dr. Marjorie Pacioles-Flavier, an obstetrics and gynecologist and a gynecologic oncologist, and Miss Marilou Amancio, a cervical cancer survivor, to talk about their experience and expertise.
Cervical cancer or cancer sa kwelyo ng matres ay isang klaseng cancer sa mga babae which is part of the uterus. So, ang uterus is made up of the body and the cervix. So, this is the opening of the uterus. Cervical cancer is caused by the human papilloma virus. So, itong klaseng virus na dumadapo sa kwelyo ng matres ng babae. 70 to 80% of the causes of cervical cancer is caused by the human papilloma virus.
Yung symptoms ko po, nagpa-check up ako dahil akala ko menopausal na ako. Kasi abnormal na po yung regla, menstruation ko. Akala ko magregla na ako. Pag umiihi ako, may spotting na lumalabas sa ihi ko. Tapos may nagdi-discharge na hindi ko alam kung ano yun kasi may amoy.
For early stage cervical cancer, actually there are no signs or symptoms. So that's why most of the women or Filipinas, they come to the clinic already at a late stage because there are no signs and symptoms for early cervical cancer. For the late stage cervical cancer, palaging reklamo ng mga kababaihan ay may mabahong discharge sa puwerta or sometimes pag nagtatalik or nagsisex, may konting dugo pagkatapos or masakit makipagtalik. Complicated symptoms or for late-stage cervical cancer include pain. So usually, ang mga babae nagko-complain ng pain sa puson or sa likod na hindi nawawala sa ordinary gamot. Palagi hong may discharge or mabahong, parang ang sabi nila, hugas isda or blood-tinged vaginal discharge. Yung iba po, nahihirapan ng umihi or dumumi. At saka, minsan namamaga po ang paa or yung edema. Cervical cancer is diagnosed by a biopsy or kukuha ho tayo ng laman sa kwelyo ng matres at ipabiopsy po ito. In cervical cancer, ito ang isa sa mga cancer na pwede nating mabantayan. So, yung screening for cervical cancer is yung tinatawag na HPV DNA testing. Dati-dati, kung alam ninyo, meron po tayong tinatawag na pap smear. Yan po ang screening dati. Pero ngayon, ang bagong rekomendasyon ng World Health Organization is the HPV DNA testing. Kung hindi naman po makakapag-HPV DNA testing, we can still proceed with the pap smear or yung visual inspection with acetic acid. Those are some screening modalities for cervical cancer.
Nag-decide ako na magpa-check up sa OB-GYN. Sabi niya, ina-advise niya sa akin na ang resulta sa sa ultrasound is menopausal. Tapos yung yung pap smear, marami daw akong abnormal na cells. Tapos sabi niya, i-recommend daw niya ako sa espesyalista na doktor dito sa Davao kay Dr. Flavier. Di na ako nagtaka kung sabihin ni Doc na bad news, ma'am, kasi cancer ang result. Sabi ni Doc, yung case mo, 95% pa na maayos pa yan, maligtas ka pa. Yung yung 75, nakaligtas nga, pag mag-process ka ng ganyan.
It is very important for you to consult your obstetrician gynecologist if you have signs and symptoms of cervical cancer because cervical cancer at an early stage is very treatable. So there are 3 different treatment options for cervical cancer. So pwede po tayo magpa-opera or surgery, pwede din po tayo magpa-radiotherapy and chemotherapy. Cervical cancer is one of those cancers that are preventable. So we are very lucky to have found out that the causative agent for cervical cancer is the human papillomavirus. So for primary screening, this is what we call yung lifestyle modification, so monogamous sexual partners. For secondary screening, this is what we have right now, is the cervical cancer vaccine. So we are very lucky that this is available in our country. And the third or the screening for cervical cancer is the pap smear or HPV DNA testing. Once again, this is Dr. Marjorie Pacioles-Flavier. I hope you learned something from this video. So for all women out there, starting at 30 years old, please visit your obstetrician and gynecologist to have your pap smear or your HPV DNA testing. And starting at 40 years old, please get yourself a mammogram and a sonomammogram. Also, for all mothers with daughters, let them have their HPV vaccine starting 9 years old onwards. Take care of yourself so that you can take care of others. Have a nice day.